you know, palliative care is an essential component for a patient who have chronic illnesses where the patient and the family needs lifetime support. So at KDU University Hospital, we are now making necessary arrangements to provide such facilities for those who need it.
A good palliative care service in a hospital like University Hospital KDU is really important. An established palliative care service is not available in many hospitals in Sri Lanka. So we are fortunate to have a well-established palliative care service in the University Hospital KDU.
We are going to commence palliative care approach. First time in Sri Lanka in a large hospital like this. And palliative care is an interdisciplinary medical caregiving approach aimed at optimizing the quality of life. The most important issue here is that the optimizing quality of life and mitigating suffering among people with severe complex disorders.
When you are treating a cancer, there are two different ways for the treatment. One is the radical treatment where we are trying to aim cure. So our main goal is to cure the cancer 100%. Then there are certain people where cure is not possible. Those people we treat with the palliative intent. Palliation means we know we can't get rid of the cancer 100%, but we can give best quality of life for the remaining whatever the time period that patient is going to survive. So that is very important because most of the people don't know the value of the palliative treatment. With the palliative intent, basically what you are trying to do is to relieve the symptoms. There are certain symptoms which can be rather nasty, especially pain, appetite, lack of sleep. All those things can be beautifully alleviated by a proper palliative team care. So when you say palliative treatment, there's a team. It is not single-handed treatment. There's a palliative team where all the stakeholders are involved in that. So it is a teamwork, like a multidisciplinary team where they get together and give the best quality of life for whatever the remaining period.
We get patients who come to us telling that there is nothing much can be done. But those are the patients who need palliative care. There are many more things to be done. And as a physician, what I used to do and we should supposed to do is to have a multidisciplinary team and coordinate that team and to keep this patient comfortable. We have to be gentle and talk to the patients in their own language, and not only the patient and their loved ones as well.
Hospice is a place where whenever you have a chronic illness which you have to have treatment lifetime, and when the disease is progressing with treatment, there should be a place that where you have to stay. You can't stay in a hospital throughout. So where your patient and the patient's caregivers have always facing a problem with treating them, continuously taking them for treatment, and they understand the disease is progressing. Sometimes they may not be able to walk, they may be lifetime bedridden, and sometimes some patients are paralyzed. So hospice is a place where you can have continuous support with the feeling of you stay at home.
KDU Palliative Care Center, we are mainly focusing on patients who are suffering from incurable conditions. The care itself is included of pain relief, relieving of symptoms and relieving of other symptoms of patients who are suffering from this, mainly from cancers. If someone was diagnosed with cancer at an incurable stage, that is not the end of their life. We have many facilities to care of them, to relieve their pain and suffering. It is the total care of the family and the patient itself.
Palliative care is really important, and the nutrition really adds to the quality of life of these patients. We do cater to create bespoke diets for these patients in addition to improve their health, nutrient requirements, calculating the nutrient requirements and also the caloric intake, which will help them to improve their functions and also to remain healthy during the days that they live.
Consultant ENT and head and neck surgeons, we have a huge role in caring palliative care patients. We look into the patient's breathing, swallowing and other matters related to the nasal and ear symptoms as well. If we consider about the breathing, I think a lot of patients in terminally ill patients who needs palliative care needs caring about their airway with mainly tracheostomy care. A lot of cancer patients and other chronically ill patients are with tracheostomy.
When we talk about the importance of the blood and blood products for the palliative care management, to relieve the symptoms and elevate the good quality of the life of the palliative care in the setting, so we need the maximum support from the blood transfusion service as well. With the amalgamation of the National Blood Transfusion Service, UHKDU Blood Bank has a sufficient service to provide blood and blood product transfusions to the patients in the palliative care.
Palliative care is not just vital in providing conventional medical treatment or controlling symptoms of the patient's disease condition, but also it aims to provide holistic care, giving a better quality of life.
Urologist role come into palliative care when there is an obstruction to urinary tract. Now this obstruction could be in the lower urinary tract, as we commonly know bladder outflow obstruction, or maybe upper urinary tract when the ureters are obstructed. So obviously the aim is to decompress. Now if it is lower urinary tract, there are number of options. If we can surgically decompress, that is the best option, failing which they will need a catheter.